Silent strokes. One of our followers asked me to talk about silent strokes. What are they and how do we diagnose them? So silent strokes, essentially the patient has a stroke without any symptoms. Now, how do we find out that the patient had them? Patient comes to us for any reason. We ask an MRI of the brain for a particular reason, not for a stroke. And it shows up on the MRI. It shows up as white spot in a particular pattern on MRI. So we diagnose him that the patient had small silent strokes in the past. We call it small vessel disease. Now, what does that mean to the patient? I treat him as the patient had the strokes. I evaluate the patient for risk factors for a stroke. Risk factors for stroke including high blood pressure, diabetes, high cholesterol, obstructive sleep apnea, carotid stenosis, or cardiac arrhythmias. I evaluate the patient. If they have any of those, even if they were not diagnosed previously, then I treat them. The more we lower the risk, these risk factors for stroke and treat these problems, the less likely that the patient will have a stroke. The reason, because patients with silent strokes, then they are more likely to have an actual stroke with symptoms. So to avoid it, then we assess the patient for risk factors, we correct the risk factors, and we treat them with antiplatelets. Most likely aspirin, or it could be Plavix, or it could be anticoagulant if we find something in particular and we need to treat it. So if someone found on MRI that you had silent stroke, it should be taken seriously. You should see a neurologist for an assessment and evaluation and then treatment. Thank you.